And in terms of augmentation, there are so many different permutations of how we can use fat to either improve contour in terms of aesthetic reasons or in terms of reconstructive reasons. So we now are using processed fat, so you do liposuction. You take the fat and process it, and we have various ways of doing that, but in real time. And then we inject that fat to where we want it. So for example, if a woman's had a lumpectomy for breast cancer and has a deficit in one breast, we can use fat from, say, her hips and fill in that contour deformity. It does last. Our techniques have been evolving, and in the literature, it reportedly lasts anywhere from 30 to 70%. Our experience has been at NYU that it lasts more in the 70% range, and that's forever. So once it lasts, it sort of takes and it develops a blood supply, and then it really becomes a part of the body to where you've transferred it. Once you become an adult, basically you have a set number of fat cells, and what happens is if you were to gain weight, they grow or hypertrophy. If you lose weight, they shrink, but you don't actually increase the number of fat cells that exist. So, and that's something we have to be a little bit careful about. So once it has taken, if somebody were to gain a lot of weight, they might gain weight in the fat that was placed wherever it was. So in an area like a breast, maybe that doesn't matter so much, but if you are injecting, say, the cheekbones to create a little more fullness in the cheeks as we age, everything drops a little bit, that might be an issue. So we have to advise patients that we don't want you gaining or losing a lot of weight because it will change how the fat behaves. Yes, it can always be improved upon, both for reconstructive patients who maybe never had reconstruction or had a reconstruction that now, 20 years later, doesn't look so great, or for women who have had augmentation and then have aged and things maybe don't look as great as they used to. Those can always be improved upon, and either with the techniques I was talking about earlier with fat transfer or with removing an implant and replacing it, or sometimes a combination of things. I think the techniques for fat augmentation are really exciting, especially for reconstruction, and particularly in breast reconstruction. I think we have really figured out how to make the fat last and can transfer it to really any place on the body, but especially to breast reconstruction. It's sort of a perfect fit. And I think that's really exciting for a woman to be able to maybe even have an improved body after having breast cancer. I think is a nice silver lining.